Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, the Health Department declares a national dengue alert in several regions.
Every 3 to 4 years is really a phenomenon. We want to raise awareness among the public.
I think considering the numbers that we've seen already this year, we have to brace for a severe dengue epidemic this year.
Following the spike in dengue cases despite intensified prevention measures.
They are brought to the hospitals rather late in the stage of the dengue infectious process. That means that the complication, third stage, has already been reached.
Also, a Senate resolution seeking to probe alleged ghost dialysis and PhilHealth related scams.
Simple cough, but they have claim for pneumonia, an appendicitis operation, but they claim for a higher with yung isang procedure na mas mataas yung benefit package.
And the implementation of the universal health care and other landmark laws for the health sector. This is a State of the Nation Address special. Health Secretary Francisco Duque joins us live. Thank you for joining us. I'm Pinky Webb. The Health Department declares a national dengue alert following the rapid increase of dengue cases this year. More than 100,000 cases of dengue were recorded from January to June, with one province even declaring a state of calamity to address the surge of dengue cases. Also, the health of agenda of the Duterte administration in the next 3 years. We also get an update on the landmark laws signed by the president, like the Universal Health Care, Mental Health Law, and the National Integrated Cancer Act. Let's go straight to the source of the story. Health Secretary Francisco Duque. Secretary, again, welcome to the show, and thank you, sir.
Well, thank you very much in behalf of the DOH for this opportunity.
Sir, should we be concerned with this national dengue alert? I have a couple of friends who are a little alarmed by this.
But they should be. We should all be alarmed. That's the objective of having declared a national dengue alert status, is precisely to raise public awareness of this threat happening at a time of unexpected dengue spike. It happens every 3 to 4 years. So we have 20 right now. Just within half year, we have 106,630 cases, which are 85% higher than the 57,000 plus same reporting period last year. So nakakatakot. So baka umabot tayo more than 200,000, which is the same problem we had in 2016 and also in 2013, and if I remember correctly, even 2009.
So that's why you were saying there's generally a pattern of an increase every 3 to 4 years. Sir, I just wanted to question the numbers you just raised. In fact, I read about this too. You said the health department is saying there was an 85% increase in the cases of dengue this year compared to last year.
Exactly.
This year, it's about 106,000, and last year it was 57,000, sir?
Correct.
That's just...
Thereabouts.
Okay, so, all right, so that's about, again, you're saying an 85% possibly increase. When do you actually, what are the indications for you to declare a national dengue alert?
Well, this is the first time that we have declared a national dengue alert, and this is aligned to the alert system that has been adopted by the National Disaster Risk Reduction and Management Council. So, inalign lang natin. But technically, if you say that you are on an alert, in an alert level, you are essentially saying that you have several regions which are classified under Code Red, which means that they have breached the epidemic threshold, which is an average of 3 to 5 years of dengue cases.
3 to 5 years?
Yes, 3 to 5 years in the past.
Yeah.
And then you compare it to your current dengue numbers. And then if it has breached that, then you say it's an code red or an epidemic
Threshold. Which from reports and with you, sir, it's Mimaropa. These are the areas that exceeded what you call the epidemic threshold. Mimaropa, Western Visayas, sir, Central Visayas, and Northern Mindanao.
Well, there are two codes here. One is code blue and one is code red. Let's go to code red. There are 5 regions under code red, 5 of 17 regions comprising 29%. And these are regions 4A or Calabarzon, regions 5, 6, 9, and 10. Now, those almost reaching or breaching the alert and epidemic thresholds would be 8 regions. 1, 2, Mimaropa.
So let's say Ilocos, Cagayan Valley, yan ho ba yan?
Yes.
Calabarzon.
2 is Cagayan Valley. Then you have Mimaropa. And then regions 8, the Bangsamoro
Autonomous Region.
BARM. And then 11, CAR, and 12. So
I
that's
see.
for a total of 8 of 17 regions, comprising 47%.
8 doon po sa exceeded the alert threshold and 5 doon po sa exceeded epidemic
Yes,
threshold.
exactly.
So 13, sir.
Yes, yung iba, mababa, NCR,
Yeah.
surprisingly, but we still have 6 months. NCR is about 21% lower compared to last year.
And
Strange, no?
yeah, why would that be? Is there some sort of explanation to that, sir?
It's, I guess, because the rainy season has just started and relatively late start. We've had long months of drought. In fact, we had to conserve water. You knew that crisis in sometime in March, April, and May. And so people needed to conserve water, but we also warned them, alerted them that when you conserve water, you have to make sure that you close the containers, otherwise that's the favorite place
Breeding
for
place.
breeding place or pamugaran ika nga ng mga lamok.
Dengue,
Ay magiging
mosquitoes.
kite-kite, tas magiging lamok, yun din naman kakalat.
Sir, there are areas that are reporting to have, well, an increase, as you mentioned, sir. Let's talk about Maasim in Iloilo. The reports are saying that there are families now staying in a gymnasium, which they actually call a hydration facility. Can you tell us more about that?
Well, the hydration stations or facilities are really temporary or makeshift facilities that will provide the hydration, fluid hydration of patients. So instead of managing them straight in the hospitals, which are already congested because of very high rates of admission, these are temporary facilities and makeshift, like the gymnasium, rural health units, city health centers. So we have set up, our regions together with the local government units have collaborated and coordinated the setting up of these hydration stations for the reason being very important is hydration is a mainstream intervention.
I see.
There is no medicine, antibiotics, or antivirals for dengue.
None.
Yes, and there is no vaccine for dengue. Okay, so now hydration is one of the mainstream interventions, and sometimes just giving them hydration would already quickly reverse the infectious process and preventing it from entering into a dengue with complication stage.
But having them stay in a gymnasium, Secretary, is that not dangerous for them? Because it's open air, hindi ho ba? Hindi ho ba mas nakakatakot yun?
Lahat naman sila may dengue.
Oo. Pero ibig ko sabihin, is that normal? Siguro ganun na lang po.
Yeah, well, just
Kasi
like...
nandiyan na sila. Parang sila ho ba yung medyo on the mild case? Ganun ba yung first stage?
This is triaging. You call it triaging, which means you evaluate each of the admissions, okay, at the ER, and then you say, ito, hindi pa ito, okay pa ito.
Depending on the platelets, sir.
Depending on the symptoms, the clinical evaluation, the clinical symptoms, and also the laboratory findings, no? So if they see that you're closing in doon sa dengue with complications, they'll have to admit you.
Hospital.
Yeah, because you need a more aggressive management of that particular dengue.
Yeah.
Yung naman mga mild, ikinako na lang sila. Hydration muna,
And this is the one
symptomatic.
that's
That's
happening
what's
here. So ito
happening
yun.
in the gymnasium,
in
makeshift,
Masi. Yeah.
and also in the rural health units and city health centers, where, by the way, we have deployed in Region 6 about 284 human resource for health complement. These are nurses and midwives.
All right, but there are
techs.
also areas now, Secretary, that declared a state of calamity also.
Yes.
Yeah.
After the declaration of an outbreak by a local government unit, that decision or declaration is now passed on to the LGU, Sangguniang, Panlalawigan, Panglungsod, and then they now agree to declare a state of calamity so that they will be able to access their quick release funds.
Yeah, because they need that. Sir, we're showing it on the screen.
Yeah.
For example, in Zamboanga, Sibugay, state of calamity po dyan, there are 3,500 dengue cases, and there were only 150 dengue cases in 2019. Sir, that's a 2,000% increase.
Yes, again, it's because of the spike.
Yeah.
This is contributing. This is really what you see every 3 to 4 years.
All right.
So it's a small wonder that you get these kinds of massive increases compared to last year's number.
We'll be taking a short break. This is The Source on CNN Philippines. Coming up, the implementation of the Universal Healthcare Law and other landmark laws of health under the Duterte administration. Health Secretary Francisco Duque will still be with us after the break. Dengue, malaki ang posibilidad na pati kayo. Kasi nandun ang lamok. Ganun yung common sense doon.
Yes, posible yun. That's why pagka marami ng cases in a community, more than 2 weeks, you already do
nakakatakot na yun, 2 weeks.
spraying, larvicidal applications. You get the LGU to do the fogging, selective fogging within a 5-meter radius. But then, the mosquitoes can reach 2 kilometers.
Lilipad yun.
Kasama yung wind factor.
Oh my gosh. So yung 5-meter radius,
500 meters.
500, wala yun.
Wala yun.
You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sir, I was asking you a common sense question kanina during the break, which I want to ask again now. Kapag ang inyong kapitbahay, someone in your neighborhood ay tinamaan ng dengue, malaki ho ba ang posibilidad and how do you prevent getting it to? Kasi andun yung, I guess it's safe to assume, nandun yung dengue-carrying mosquitoes around the area. So
Yes.
kailangan mag-ingat ka kung ikaw yung nakatira din doon sa paligid na yon.
Yeah, you have a high index of suspicion, right? So what you want to do is you want to make sure you follow the 4S contra dengue. That's search and destroy, as I've been saying it a million times over.
Which you need to keep repeating, sir.
Yeah, we need to do that.
Search and
It's a job.
destroy.
Yeah,
The
search and
4S.
destroy, 4S, and then seek early consultation when you have a fever, 38 degrees centigrade, for more than 2 years, pain at the back of the eyes, really pain, your fatigue, malaise, kasukasuhan, and then the bone pain also, parang dinudurog, no? Because I know that because I had dengue myself. My wife
That's a
managed
telltale
me.
sign, Yeah, okay.
Yeah. Okay, and then you have abdominal pain and LBM. Sometimes you have nausea. And really very severe symptoms that
Nanghihina
one
ka talaga,
experiences.
no?
But nanghihina ka,
Yeah.
talagang fatigue.
And
Some
then-
people cannot even move because of the pain. Yes, yes.
And then, of course, meron ding self-protection, yung 4S.
Yes, insect repellents,
Yeah.
and then your long sleeves, long pants. Avoid black colored.
Yun nga yung sasabihin
yeah,
ko,
because
sir.
the mosquitoes color black with white bands, right? So what best to camouflage them?
Then, to go to
Yeah,
dark
to a dark
colored.
color, dark blue
Yeah.
colored clothing material.
You mean if you wear something colorful, it will, they will parang lalayo sila sa'yo? Ganun ba yun?
Well, hindi sila attracted doon. Mas attracted sila sa mga
Sa
dark.
itim.
Yes. Kaya nga yung mga gulong sa taas ng bubungan, di ba, para
doon
wag
sila.
liparin, doon
Yeah.
sila.
Yeah.
So I keep saying, butasan ninyo yung mga gulong na yon para hindi maipon ng tubig
Correct.
o sementohan ninyo sa loob. And then gamitin ninyo. Pero sana, wag naman lumusot doon sa bubungan.
But, you know, sir, marami ho kasi mga magulang, of course, they're afraid for themselves and their children,
Of course.
especially if they go to school, sir. Hindi naman ho talaga palaging kailangan ka mag long sleeves. What's the best immediate prevention for this? Would it be really a spray? Would sprays really help doon sa hindi sila makagat ng dengue-carrying mosquitoes?
Yeah, it can help because that's one of the 4 S's.
Is it 100% foolproof?
Well, very high success rate.
Okay.
But also, you have to be very careful because this is chemical
Yeah.
sprays
Yun na nga, sir, eh.
being used. So it's not entirely without any toxic effects. That's why it has to be controlled. And you have to follow a clear protocol that, you know, you send people out and then while you do the fogging, selective fogging.
Yeah.
And so it's just one of the many measures within the 4S
Yeah.
contra dengue.
And you were saying, sir, that yun, yung ginagawa mga fogging operations, yung ganyan po, ang dengue, sabi nyo, can travel, because we were talking about a particular, let's say, neighborhood na tinamaan ng dengue ang ilang mga tao doon, posibleng high risk ka rin, ano? But you said, sir, ang dengue-carrying mosquito can travel how far?
Well, normally, if you without the wind factor, it's 500 meters. But with the wind factor, it can be brought to as far as a 2-kilometer radius.
Wow.
Oh, so that's it.
Yeah. So hindi ka, when you think about it, kailangan yung measures, yung defog, yung fogging operations.
Well,
are-
you start at home.
Of course.
Of course, you have to start at home. You know, I've talked to families in the many communities that I've visited where surprisingly one family has majority of its members had dengue.
Yeah.
And then so I inspected the refrigerator, yung salukan ng tubig, when you
ilalim.
defrost,
Yeah.
right? So that's black tray, dark gray tray,
That's
and then there's
stagnant water.
water, stagnant water, and people forget.
So don't forget that.
Yeah, when
you need to
remove
look
it,
into that. Yeah.
Right. Especially kung hindi naman siya, ano yun, yung yung walang yelo, nag-yelo yung refrigerator. the old,
Automatic, yeah, nagdi-defrost
technology.
siya,
Yeah,
yeah.
oo. So pagka di-defrost mo yan, magkakaroon ng tubig doon,
Alright.
doon. Tansan nga lang pwede ka nang magkaroon ng maraming kitikite.
Doon sa tansan pa lang na may tubig.
Oo. In fact, some spaces
Yes.
in certain plants, doon lang.
Yeah.
Pwede na magkaroon ng kitikite.
All right, so those are the things that we need to do to, protect ourselves from the dengue-carrying mosquito. Let's talk about the immunization programs, or a problem of the Department of Health, but there's some sort of good news right now, sir. Nag-increase na po yung accept ng tao sa immunization program ng Health Department.
Thankfully, for our cohort, the first cohort, which consists of children 6 months to 59 months of age, no, the measles vaccination coverage has reached 98%. So it's very high now.
Yeah.
In just about 5 months, we declared the measles outbreak in February 6, March, April, May, June. As of last week of June, we already had the 98% coverage, which is a far cry from what it was last year. 10 months, 30% for that cohort. We did supplemental immunization activity alongside our outbreak response immunization. Now we're in the second cohort, okay, school-based.
What is cohort?
Cohort
mean?
is a group
Okay.
of people or children that you differentiate. Yeah, you target
For
them.
that particular.
Like first, we targeted the children 6 to 59 months of age.
yeah.
It's the first cohort. The second cohort, school-based children, kindergarten to grade 7.
Okay, yung grade
so
school na.
we have about 9.9 million targeted.
So they're next.
They're next.
Okay.
We're doing it now. I've been going around for the past 4 weeks, launching the school-based immunization, first in Taguig, and then followed sa Manila, tapos what's the other one? Quezon City,
Manila,
and then
Quezon City?
Pasig City. Oo, the other day I was in Pasig.
Okay, so that's for measles.
Measles, yes.
What else is?
Well, we also are
in the
giving
offing?
at the same time diphtheria and tetanus booster doses.
Okay.
But we have other, what do you call these, vaccines?
Yeah.
For hepatitis B, for PCV for pneumonia, for both children, PCV 13, and PCV 23 for the elderly. And then we have, of course, for TB. Then we have for pertussis or DTP, diphtheria, pertussis, tetanus, then measles, mumps, rubella. And then we have for women, the human papillomavirus vaccine, HPV, to prevent possible cervical cancer.
So good news there, at least there is encouragement. The people are again believing the immunization
First,
program.
because of the fear from our declaring an outbreak in February 6, the challenge is
The
how do we
measles
translate the
outbreak,
fear into a longer
Positive
lasting trust and confidence.
Which is starting
It is
already, as proven
starting
by the
the-
98%.
Yes, the Philippine Survey Research Center has done a survey in May and showed that 91% of the respondents said that the vaccines are important. And then 89% of the same respondents say that the vaccines are safe.
Yeah.
And then...
Yung willing, meron ba?
Then 91% of the respondents say that the vaccines are of quality. So, ang laki ng itinaas.
mataas na yan,
Compared to that last year, 32%,
Yeah.
yung vaccine loss, trust, and loss of trust and confidence, sumadsad talaga sa 32%. So now you see a marked difference between the two, situations, and this is good news.
All right, we'll be taking another short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sir, universal health care, what is the latest here?
Well, we're still putting together the IRR, meaning we're getting inputs from our stakeholders, various stakeholders, from the academe, from the healthcare practitioners, from media, from the local government, chief executives, from the LGU healthcare workers. So it's a whole, the breadth of consultations that we're doing. And in fact, our team is right now in Davao City.
And how long till the IRR is put together,
Well, the
implementing
target-
rules and regulations?
The target is to issue it sometime last week of August. But by law, we have till September.
Is it 6 months?
6 months.
Secretary?
180 days.
And then so by September, what can we expect?
Well, we can expect that the remaining uncovered Filipinos will have to be enrolled in the Universal Social Health Insurance, or PhilHealth. So, but that's just not too many at this time.
Yeah, so how many are enrolled now, and how many?
104 million are enrolled out of 106 population.
104 million
which
are
is about-
presently enrolled.
Yes, which is about 98%
Yeah.
of the
So
population.
you're hoping that the 106, and of course, aakyat pa po yan, will be
Yeah, because the
completely.
population growth rate by 2022, you expect 114 million.
And over and above that, Secretary, is that there, the universal healthcare law also is preventive, hindi ho ba, rather than a cure. We want people, the government wants people to be able to have checkups, to be able to prevent certain illnesses in the future.
Exactly. At the core of the universal health care is really the provision of primary care. The problem in the Philippines right now, in the way we deliver our health care, is that people are too oriented to going to hospitals. Hindi ako gagaling kung hindi ako sa hospital magpapatingin. Hindi ako gagaling kung hindi ako sa specialista magpapatingin. And this is something, a myth that we need to break. And the reason why that has happened is because you cannot also blame them, because wala talaga tayong working, adequate, quality primary care facilities. And that's very basic. That's the one that's connected to the grassroots,
Yeah.
right? So you have the barangay health station, okay? Next would be your rural health units. Barangay health station, that's about 1:5,000 population, run by a nurse and a midwife. And then the second level would be your RHUs, 1:20,000 population. This is run by a 14-person complement or staffing pattern with a doctor, of course, basic laboratory diagnostics, and of course, a menu of services covering health promotion, disease prevention, wellness preservation, and then after that you have your city health centers, then you have your community hospitals, and then your district hospitals follows. That's run by the LGUs. And then the higher level now will be your provincial levels 1 and 2 hospitals, okay? Some are which are departmentalized, and then that connects all the way to the DOH, retained hospitals and medical centers. And ultimately, you have your APEX, heart, lung, kidney, and children's medical center. And hopefully, it won't take too long, we'll be able to add the cancer center.
Yeah, I wanted to talk about that too, but sir, we're running out.
Of course, by the way, we need to have you need to overlay a working referral system, both upward, downward, and horizontal geographic.
Down, going up,
Yes.
up, going down, and of course side to side.
Side to
Parang
side,
ganon,
because in geographic, horizontal referral system.
So what we're seeing is, hopefully by September, we'll have a better idea on the implementing rules and regulations of the Universal Healthcare Law. That's one.
That's first.
Okay.
Number 2, we're doing now the implementing sites, select pilot sites or areas which have expressed the willingness or the strategic readiness to already integrate their local health systems into a province-wide or into a city-wide health systems.
Yeah.
Yung pinag-usapan natin yung network, kailangan it has to be in the context of a network. Hindi pwedeng stand-alone. Our problem has always been stand-alone. Ako, hospital lang ako. Wala akong pakialam dito sa RHU, wala akong pakialam dito sa health station.
Yeah.
That has to change entirely.
It needs to stop. Sir, very quickly, a resolution in the Senate on this alleged ghost patients. Ang tawag mo dun sa sinabi mo, sir, over yung pag ina-upgrade mo yung sakit ng tao.
Upcasing.
Upcasing the case, yeah.
Yes, okay.
So,
to be able to collect more, they misrepresent.
Yeah.
So it's a fraud,
Upcasing.
form of misrepresentation and therefore fraudulent.
So it's time that the Senate really look into this fraudulent claims and these ghost
And the
patients.
systems, and the systems, a
system in
review
place.
of the policies, everything. It has to be comprehensive with the end in view of PhilHealth leveling up its capacity to prevent prevent fraud, to deter, and to detect fraudulent claims.
All right, thank you to Health Secretary Francisco Duque. Thank you so much, sir. We'll see you again soon.
Thank you very much.
Thank you.
In behalf of the DOH.
Thank you, sir. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.